Okay, so the explanation of what is happening in the the color slide 2 mononucleosis agglutination test, we had reagent A. Reagent A, we used 1 drop, and in reagent A are antigens from the cells of guinea pig kidneys. I misspoke in my procedure video, I believe, and said antibody. I apologize for that. But reagent A contains antigens from kidney cells of a guinea pig. The reason for that is there are many different kinds of antibodies that may be present in the patient's sample, known as heterophile antibodies. Some heterophile antibodies are produced in infectious mononucleosis, or IM. Other heterophile antibodies are randomly also floating around and are produced due to other reasons or other infections in the past. So what we want to do is we want to make sure that these green random heterophile antibodies get taken out of the patient sample so that they don't interfere in the results we're trying to read for the presence of mononucleosis. So by adding antigens from the kidney cells of guinea pigs to our patient sample, 1 drop of patient sample added to reagent A, that was the first 2 things we mixed together, those random heterophile antibodies will bind to the guinea pig and will no longer be able to take part in the next step of the test. So the next step of the test was mixing in those reagent B horse red blood cells. The horse red blood cells will be bound and agglutinated by heterophile antibodies produced in infectious mononucleosis. And you will see, if the antibody to infectious mono is present, you will see agglutination as a result, known as heme agglutination because it is blood that is forming clumps. Now, if we did not mix reagent A first, if we just mixed everything up together all at once, some of these random heterophile antibodies could actually take up binding sites on the horse red blood cells and prevent us from seeing good agglutination with our infectious monoheterophile antibodies. Or if those antibodies are good enough at agglutinating, they could actually cause agglutination to be seen when there actually are no antibodies present because of mono. So we could get a false negative result for our patient, or we could get a false positive if we don't mix reagent A first. Please use this as your explanation of principle for your study guide for the mononucleosis test, color slide 2, mononucleosis.